my mind recommends suicide risk screening at every primary care visit. The Patient Health Questionnaire 9, or what's called PHQ-9, is a recommended screening tool. This well-established tool, commonly used by primary care as well as psychiatric clinicians, is easy and quick to administer and provides valuable information regarding suicide risk. Question 9 of the PHQ-9 specifically asks the patient if in the last 2 weeks they have been bothered by thoughts that they would be better off dead or of hurting themselves in some way. If they have been bothered by these thoughts, the PHQ-9 then asks them about the frequency of these thoughts in the last 2 weeks, whether it is several days, more than half the days, or every other day. Research indicates that patients that respond with more than half the days or every other day account for more than 50% of all suicide attempts and deaths within the 2 years following that positive screen. Thus, as with other screening tests, we can identify patients at risk for suicide and intervene to change that risk. There is a near negligible increase of same-day suicide with a positive screen.
The following scenario illustrates the guided interaction between a patient who has indicated a score higher than 0 on question 9 of the questionnaire.
How are you doing today?
Good.
All right, so what brings you here today?
Just been having problems sleeping.
Anything that's been happening or going on that is causing you to lose some sleep?
Work's been a little stressful.
So work is kind of eating up all of your life, so to speak, and it's kind of stressing you out. It seems like you're a little down.
Yeah.
I kind of looked at this questionnaire you filled out. Tell me a little bit more about feeling down, kind of depressed, not sleeping well.
Yeah, I think it's just me not really being able to do like a lot of things that kind of are able to help me wind down.
So how do you reduce stress at this point?
I have a drink every so often.
You drinking?
Probably more than I should.
Okay.
Like now it's kind of like on a daily basis.
So I've been drinking on a daily basis, not sleeping well. It looks like you've been feeling tired, not being able to concentrate. It sounds like, this is more than just a little bit bothersome for you.
I guess I would say so, yeah.
Okay. I did notice too that you marked that you sometimes feel you'd be better off dead or hurting yourself in some way.
Yeah, I feel like that sometimes. It kind of seems like the easiest solution.
Tell me, what were you planning on doing or had any intention of hurting yourself?
I mean, just thoughts really. I've never really come to like the actual space of really doing anything, but just like the thoughts of it are really intense.
Just because of how you've been feeling that maybe you'd be better off dead or hurting yourself, but haven't really planned anything or had any intention?
No plan or anything in motion at all, yeah.
Have you seen anybody for this or gotten help for some of the things you're going through?
I thought about it, but I haven't.
Well, definitely based on what you're telling me, it looks like there's definitely depression there, and we're here to help. There are resources that are really helpful for you. We have programs where you can talk to a therapist. There's medications. May I refer you to a program for getting some help?
Yeah, I would say I'm open to it, yeah.
Yeah, we have a program called Behavioral Health Integration. So it's really telemedicine. You can actually do it with your smartphone and you'll talk to a therapist. They can make suggestions. It's not forever therapy. They'll do several sessions. There's also psychiatrists that they talk to and they can give some suggestions on medications. And they'll always keep me informed of how you're doing. So you'll always know that I'm informed of your progress as well.
Okay.
So I'm gonna go ahead and put a referral in for you. Okay. And we're gonna try to get you in within a couple of days. I'll make some phone calls, talk to our therapist. They can definitely fast track. If ever you feel like the thoughts are becoming worse and worse, we'll give you a telephone number to call or even call emergency. There's actually numbers you can call and crisis hotlines, because sometimes that can happen. Do you have any family support or anyone, close friends, people that you can talk to or who are aware that you're kind of going through?
I have a few people I'm able to call, yeah.
The most important thing is that you are connected and that you have a lifeline and you have people that you can talk to. And
yeah, I don't really have a plan or anything, but I would say if I did, yeah, I would definitely want to talk to someone before it escalates to that.
Any access to weapons at home?
maybe just like kitchen knives.
Okay.
You know, I would say, but no like guns or anything like that.
Okay. Okay. So we always want to make sure that you're safe, and really, for us, safety is the most important concern for you, and that's why I think we should probably get you into an urgent referral. So within the next day or two, we'll have somebody reach out, or we'll schedule something so you can talk to someone.
Yeah, sounds like a good plan.
Okay. Today, I'm going to prescribe some medications. You'll be talking to the therapist. They will kind of give additional assessments. If they want to change anything, they'll let me know, and we'll kind of always be in communication with you.
Okay.
All right.
Yeah, it means a lot. I appreciate it.
Okay. All right. All right. I'll go out and I'll make some phone calls, and then we'll be back soon.
Okay.
All right.
That sounds good.
Okay.
If you would like to learn more, watch My Mind's Assessing Risk and Introduction to Protective Factors. If you or someone you know is in urgent need, please call 988.